Welcome to another episode of The Learning Curve, a podcast where we celebrate medical educators and their unique ideas. My name is Irtaza Asar, and to set the stage for today's conversation, I want you to imagine this. You're preparing for a high-stakes test. You've spent hours and hours rereading your notes, highlighting key concepts, rewatching lectures. You feel confident until test day arrives, and suddenly your brain is smush. The entire slate has been wiped clean. Does that sound familiar to you? What if I told you that much of the traditional methods that we do and rely on are actually setting us up for failure? Today, we're going to be diving into the science of learning, uncovering why passive studying doesn't work, and exploring evidence-based strategies that can help transform the way we retain and apply medical knowledge. If you want to make learning last, this episode is for you. And to help us break down the science behind evidence-based learning, I'm joined by an expert in medical education, Dr. Nathaniel Ladaga, who is a core faculty member at Corewell Health, West Michigan State University. And today he's going to share his amazing expertise in how we can study smarter, not harder. So let's get started with the conversation. Nate, thank you so much for your time, man.
Thanks for having me. What a beautiful intro, by the way. I think that's good for the episode right there. That's it.
We've peaked. It's probably all downhill. No, I'm just kidding. By the way, every single one of the guests that I've brought on for the listeners has a special skill. The special skill for Nate is that he is a professional. He likes to call himself semi-professional. He is a professional rapper. So if you meet him at a conference, again, you'll see the recurring theme: confront him and ask him to drop some bars for you. And he is going to light your world on fire. I kid you not, confront him. So I'm setting you already up for success.
Setting me up for the opposite of success. Now we're talking about rap bars. Now you're setting this bar for me way too high. So when people see me, they're going to be disappointed. But now I have several months to prepare sneakily. So these conferences, people, if they ever come up to me, then I'll be ready.
You'll be ready.
You just set the challenge.
You'll be ready. You'll be the emergency medicine Dr. Dre. I'm excited. And that's a callback right there. Inside callback. Somebody ask him about it. Okay. So let's get started with today's episode. So Nate, just to set the stage for this conversation, let's talk about traditional studying. Traditional studying tends to be very passive. From your experience and your work with medical students and residents, why do you think traditional studying fails?
That's such a hard question. And traditional studying, for most of us, is typically the same thing. And so when you survey any student, and this goes back to like high school, undergrad, medical school, even residency, you've developed habits since high school and through undergrad, I think is the majority of it. But if you survey people, then most of them say like their main study habit is to just pore over lecture notes, is to rewatch lectures, is to rewatch videos, is to highlight stuff or take a couple notes off the lecture screen. And then what do they do after that? They just revisit those same notes. You highlight again, you reread it. Oh, okay, I'm learning. This is my way that I'm learning. So that's like the traditional approach that most of us were taught. And if you think of it in that sense, it fails because we are taught like what to learn, but not how to learn. And I think that's just a very interesting thing that's just been skipped over for the majority of us. I've never been told throughout how many years have we been in school now? A decade plus, right? All these years of schooling, and nobody's took the time to say, here's actually the science of what makes you a good studier, a good learner, and then eventually a good like test taker, physician, whatever you're studying later in life, a better professional. So it's always been a focus on the what and get through that what as much as possible, as many times as possible, rather than, well, how are you actually attacking that information? That is where I think there can be a switch.
Honestly, I think that's such a fascinating and insightful point, because I think about it from my experience as well. And something that you said just really hit home with me. Nobody really teaches you how to think about thinking. It's more so, hey, you've got an exam coming up on Monday. Here's the material. We hope that you do well. But to be able to do that information processing that actually connects with you, resonates with you, and also helps you from a long-term retention standpoint, I don't think any really helps in that direction. I think that's something that we as educators definitely can do a better job at. I mean, I can personally relate to this. Studying for anatomy, my first test, oh my God, I bombed it. And it was more so one of those moments where I realized that, hey, I can't sit there and just read like netters over and over and over again, because clearly it's not reflecting on my test performance. And in talking to other students, other educators about what I could have done better, they pointed me in different directions. And those are some things that we're going to talk about throughout this episode just to help other learners out there. So, Nate, from your standpoint, we talk about a lot about learning styles. So let's debunk that myth. Can you talk to me more about learning styles and what your thoughts are on that?
Yeah, certainly happy to help. From all empirical evidence that exists on learning styles, it shouldn't be addressed anymore. This is a way that's going to make you learn more efficiently, to learn for the long term. I think for decades now, and this, if you look back at a lot of the studies that are quoted, this goes back to decades, and every new decade comes and like, well, we haven't still yet to see any positive evidence that learning styles is something that we should be driving, yet it still persists. Yet we think because, man, I'm just not great at reading, which is me personally. It's like I'm not good at reading, so I have to absorb all of my information through the auditory senses or visual senses or kinesthetic, and that's really going to unlock my learning for me. And as many times as they try to study this question, there's just not strong evidence that that's truly a thing. Now, from what seems to be apparent is we all seem to learn better visually, like globally across the board. But that doesn't necessarily mean that you need to do everything visually in order to learn. The way that this can be summarized best is if you study something, for instance, art, if you want to get better at art, you better study it in a way that makes sense to that subject. So if you're going to study art, you should go look at art. So that's like a visual thing. You shouldn't just read about what makes good art, right? That's going to be a disconnect where that visual part is such a huge component. If you're going to play piano, you can't just read notes. It's a part of it, but you actually have to play piano. And if you're going to practice medicine, have to practice medicine. But there's going to be ultra different parts of this is reading from a book, listening to different podcasts, hearing lectures from experts in the field, and then taking all this information and then combining it into one. So just relying on one of those things that you think you're the best at, and that's the way that your mind is supposed to work, you're just going to miss so many different aspects of what makes for good long-term learning.
That's a really cool point. Anecdotally speaking, one of my residents, when I was talking to him about this episode, told me a story that I think really highlights what you're saying. He has a paramedic background, and he was telling me that when he was in medical school, sitting in lecture just didn't really work for him. So what he
Hmm.
would end up doing is he would go to the fire station where he would work, sit down, grab a whiteboard, and just start to draw out the things that he was expected to learn. So like brachial plexus, biochemistry, organic chemistry, just draw out all the formulas in front of him. And that actually connected with him and helped him from a memory retention standpoint. That's a really helpful key point to help to debunk that, hey, I'm a visual learner, I'm only an auditory learner. It doesn't really work for you. One of the other myths that I've heard that's been perpetuated a lot in education is cramming. And I've heard it from residents. I've heard it from medical students. I'll be
Hmm.
honest, I've been guilty of this. I think
Everybody,
we've all been guilty of
everyone's
it.
done it. You have to. There are
Yep.
times where you just have to do that because
Yep.
life gets away from you, time gets away from you, and you only have this limited amount to try your best. And then that's what we kind of rely into. Then we build this habit of that, like cramming is the way to go.
Yeah. So why does cramming not work?
If you think of it in like short term, and then there are studies to prove like in the short term it works. So you and I are both studying some new procedure technique. We practice all day, whatever, 8 hours, we'll say. And then at the end of that 8 hours, you take a test on that. We're going to feel like we did a lot of learning and we mastered the technique, right? Because this is all just like within this huge session. But then if you step away from that, a week later, we're testing the stuff again. It's the long term where you lose out. That's what we all study for in medicine, right? You don't just study something to just forget it, really. It shouldn't be affected anymore. Like, who cares about that knowledge? No, like your patient that you're going to take care of is going to want you to keep that information long term. So cramming in this sense, this mass practice, it feels so good. It feels like you're mastering this content. And then the same thing like in medical school that the majority of some of the friends that I had, test is on a Monday, you're cramming Friday, Saturday, Sunday. The rest of those days, like 2 weeks prior, you're doing whatever you want in life. You're working out, you're going to restaurants, you're going to the bar, but like Friday, Saturday, Sunday, I'm cramming so many chapters into my brain. And then Monday, they do okay. Like the short-term learning, there's no deny that it can help. Then you test those people months later, weeks later, step one, step two, whatever it is, they need to relearn that stuff all over again. And so in the short term, cramming has been shown to help. the long term is what we all strive for. And that's where you're just going to lose out completely.
I think that's a really good summary as to why cramming doesn't really work from a long-term standpoint. Again, short-term, absolutely, you might be able to do really well on that test, but when it comes time to recall that information from the inner recesses of your mind and try to apply that to patient care or other big high-stakes standardized tests, that's kind of where people tend to falter. So, Nate, from your standpoint, just if you want to give us just a brief overview, how does the brain really learn, and how does memory formation and retrieval work for our learners?
That's a great question for a memory scientist. I will do my best from the knowledge that I have, from everything that I've been just like reading myself, trying to apply. I've been teaching my residents. I was able to collaborate with a session just like this with the medical school that's associated with my program, Michigan State University, and actually speak to medical students. I think that's where the key is, to catch people early on before they develop bad habits. I gave a talk similar to this to my residents, and some came up to me afterwards and said, "I'm so glad you told me that. Why didn't nobody tell me that sooner? Now I've had 4 years plus of just horrible habits." But to kind of break this down into simplified terms in which I give my students, think that you're watching a lecture, example wise. Your visual information goes to your auditory information, temporal cortex. So it's sitting in your brain, your cortices. And your brain throughout the day has to sort through millions of different things to figure out what's important. What do I need to scrap? Because there's so much out there, right? Your brain can't hold on to everything. And so if you're just passively watching, passively listening, that information essentially sits in these cortices. 20 minutes so goes by, you forget a big chunk of that stuff because your brain never signaled itself that this is important information to hold on to. Let's compare that to a student who's listening to lecture and is actively engaged. So it's every time the presenter is talking about something, they're thinking, okay, what are they going to say next? Well, can I relate what that person just said to something that I've already learned before, or a patient that I saw before? Or they just said that. Can I rephrase that in my own words? Just that level of active engagement. And this is a technique called like elaboration too, trying to connect pieces of information to existing knowledge. Just that level of engagement not only just keeps that stimulus in those cortices at high levels, it transitioned it to frontal cortex, which is like critical thinking. And then that triggers like your brain to be like, this is important information. I need to hold on to this. Hippocampus to all these other structures for like long-term connections too. And so you've just made multiple different areas of your brain go crazy for this information that it's just craving for. That's kind of the chemistry, the neurobiology behind how we get stuff into long-term easier when things are just not stressed in that way. They just sit in your brain for a moment in time and then they're gone the next.
That's an amazing overview. And I think that's actually a really cool segue into getting away from the traditional methods, which sometimes can really cause a lot of problems for learners, to let's talk about the science of what does it mean to actually get effective learning. Now that we understand and have an idea of how the brain puts these pieces together, Nate, let me ask you this. How does spaced repetition work? And why is it more effective than cramming? Because we just established the premise that really cramming will help you with short-term learning, but when it comes time for long-term retention, that's when folks struggle. So how can spaced repetition really help with that problem?
Yeah, that's fantastic. And as I had mentioned, the brain will filter through millions of different stimuli in a day, and it has to get rid of a lot of stuff, right? So you can find this on Google, the forgetting curve, and you'll see that they've marched this out to, "Hey, I'm going to teach you something right now. How many minutes goes by until you like completely forget everything that I just talked about?" Number that I like to highlight, within like 20 minutes, you forget a half of what was just said. And the further you go, it's kind of like this nice slow decreasing curve. So that's the forgetting curve. That's natural. So as you cram, like all this knowledge is theoretically at 100%, it's kind of staying there, you get tested, and then you leave an hour, 2 days, whatever it is, you're forgetting, you're way down here on the forgetting curve. So the key for spaced repetition is it's going to interrupt forgetting. So here you are, you learned something, 20 minutes goes by, an hour, a day, a week, whatever it is. Spaced repetition like gets you back up to that 100%, and then you're going to forget again, back up to 100%, and then it goes down that chain. What you will notice is every single time that you relearn or restudy this information, yes, you get up to 100%, but that forgetting curve, instead of being this steep, after the first study session, it's like a little less steep. The second session, a little bit less, a little bit more shallow, and third and fourth, and so on. And so it really just protects you from forgetting overall. So the more times you do it, yes, you refresh your memory, but then you forget at a slower rate as time goes on. So that's the beauty of spaced repetition.
I think that's one of the ways our medical curriculums have also tried to help incorporate that, specifically through use of question banks. And I think question banks themselves become a safety net for allowing residents and other learners to have spaced repetition. And this is one of the things that I've also tried to work with my residents on as well, where, hey, if we see something clinically on shift that's really interesting, or that you felt like you had a knowledge gap on, really the best thing to do would be take some time, read up on it. So that's one level of reinforcement. And then subsequently try to do some questions on whatever topic that we just talked about or that you saw on shift, getting that extra layer of spaced repetition. And I think that's really, from a retention standpoint, extremely helpful. Just, I found that those learners end up doing a lot better on standardized tests as compared to learners that don't apply those principles. So aside from question banks, there's a lot of other great platforms like Anki. What are your thoughts on Anki as a tool to help our learners?
Yeah, everyone uses it. Well, I can't say everyone. A lot of students use it. And when I talk to the medical students, that's what they're doing at all times. And it makes sense. It feels good. Yes, it's getting to the science of spaced repetition. I love that part about it. What can be dangerous, when other experts will say it might be dangerous about it, is it's much better to create your own flashcards than to rely on someone else's for you. Because a couple things, you don't know how accurate their information is. Now, I think programs like that strive for really high accurate information. So I don't think they'd be in business very long if they were giving out the wrong information. So in any case, if you're going to use a program like that, or these cards that already exist, you really have to vet them. Number one, though, is if you create it yourself, that's already your huge chunk of just really significant learning. Then every time you do that, you're acting as your own retrieval of that knowledge that you have already set forth. So you can use this. You just have to be very, very cautious that the accuracy is there and that you're still trying to stay very engaged in the flashcards. Being a flashcard person myself, you can get to that phase where you're just barely glance the card. You're like, nah, I know it. And you're not even actually going through those processes in your brain to retrieve that knowledge effectively. And so if you fall into that trap of just oh, I just need to get through 10 cards, and you don't go through this very engaged process, it's not going to help you much better than the other passive techniques that we've talked about.
That's a really cool summary of, again, spaced repetition, but also trying to be engaged as learners. One of the other things that I've heard incorporated into a lot of medical curriculum is this concept of interleaving. So what are your thoughts on interleaving, and how can that help our learners?
Yeah, I'm happy to talk about this. Interleaving is an interesting term. We don't use it in any other way, so it's not very intuitive in what it means. It is really just switching up topics, so you can't really get comfortable with the one topic that you're focusing on. The med school that we work with, that we're associated with, that's all that they do. And so they have case-based learning type approaches, and they're hitting all systems all the time. And it gives the students a really hard feeling like they're always off balance. Man, I was just getting comfortable with cardiology, and now I got to switch all the way to neurology. There's nothing related between these at times. And so, yes, it feels clunky, but what the research will show is that when you have more effortful learning, when it doesn't come as quickly, and when you have to try that extra little bit in order to try to learn something effectively, yes, it's going to feel really bad in the short term, but it's going to really make ends in the long term. So it's really going to help you later on. And just the opposite of cramming too. We already mentioned that cramming is a short-term only type of thing, long-term not so much. Interleaving practice, anything that you do that makes learning just not as natural, a little clunky. I'm just a little slow. This doesn't feel great. Yeah, the short term feels bad, but the long term is where it's going to be the most beneficial.
That's a great segue to another great scientific evidence-based concept of elaboration, where learners try to make meaningful connections. So can you talk to us about elaboration and just kind of paint the picture for someone that doesn't really understand that concept?
Yeah, absolutely. Elaboration is, I just learned something new. how does that relate on knowledge that I already have? So how can I try to take that piece of knowledge and connect it to so many different things in my brain? And I think of it from a brain standpoint of like, how many extra synapses can I make? How many synaptic connections can I make to these different parts of my brain? So if I teach you something about pericarditis, for example, and no one's ever heard it before, like, well, I'm going to teach you like, oh, this is pericarditis, inflammatory of the epicardial space around the heart. And like, how can I connect that to other things? Well, I can connect that to virology and like your immunology courses. And like, these are typically viral based stuff, but there's all these other pathogens that can cause it. Well, I can connect this, of course, to cardiology. All right, what's the heart going to look like from an anatomical perspective? All right, what's an EKG going to look like? So that's the heart in this electrical representation. And then I'm going to connect it to patient presentation and symptoms. Well, what is the patient going to look like? What are their vital signs? If you got a chest x-ray, what would you expect to see? If you did a bedside ultrasound, you see that you could take this in so many different layers. And yeah, just learning pericarditis and like what it is and how it is on paper, that's a traditional way of learning, right? I could tell you all those things. Yeah, a patient's going to look like this. Their EKG might look like this. But if I'm actually engaging you and we're going to the bedside with a patient, or we're going through different case examples, or I'm pulling up all these different cases that I've personally experienced, the more connections you're making, the stronger that learning will be, number one. Number two, the easier it will be for you to retrieve that information later in life because you're not just dependent on one synaptic pathway. You've just created several that you can leverage your mind pathways to get to that core knowledge that you're seeking.
Absolutely. That's something that I've stressed to a lot of my residents where, hey, you saw Brugada syndrome. So now's the time to actually build those synapses so that when it comes time for the boards, you'll be like, dude, I saw Brugada. I know it's a sodium channelopathy. It's autosomal
Yep.
dominant. 90% of patients that get diagnosed with Brugada are usually post-arrest. All these like things like, hey, go read up on
Yeah.
this so that the next time you see it, whether it's clinically or academically, you'll be prepared because you've built those connections by reinforcing that material.
The problem that would be funny is in medical education, of course, it's like, yeah, I saw Brugada syndrome, but it was an 80-year-old who walked in for foot pain and they got a weird EKG out in triage. And you're like, well, that might not help you on boards. That's just weird. People are weird. Sometimes that happens. So, yeah.
Disclaimer, don't do that on oral boards. So, Nate, let's segue the conversation. There's a great concept in educational medicine called the 4 pillars of learning. Can you walk me through that?
Yeah, I'm happy to. I love the 4 pillars. And it's something that was introduced to me in a book by a psychologist, How We Learn. And it talks about this in great length, but I'm going to try to summarize it as best as possible. So I spoke to my residents about this. So I'm very into this concept and we can break it out. What's the secret sauce for good learning? Number 1 pillar is going to be attention. And so this shouldn't be very surprising. This is intuitive. You can't learn anything unless you're paying attention to it, right? If you close your brain off to whatever you're trying to learn, your brain is going to see that signal and be like, well, this is not important. Why would I ever waste time making synapses or making neurons for this memory? And you can easily see this as if you're like listening to a lecture and you're just like on your phone, dinking, scrolling, whatever it is. You look up, you're like, oh, I don't remember anything that we just learned. So that's very clear, easy to demonstrate. So that's number 1. Number 2 is engagement. And engagement is not only paying attention to something, but you have to be generating hypotheses while you're learning this. And so for the example, going back to a lecture, if someone's giving that, you're not just sitting there just staring at like the content and listening. You're thinking, all right, what is that speaker going to say next? What does that speaker mean by this? Does this relate to anything that I've already known or done in the past? And so that type of generating hypotheses is that true engagement that we're trying to capture. Let's try to figure out ways to store this for long-term memory. So those are 1 and 2. Number 3 is feedback. Nobody learned anything and became an expert without good feedback, both positive and negative. The very common example I like to point out are like infants learning to do anything or babies learning to do anything. Walk, talk, pick something up, eat it. Like they fail over and over and over and over again. So that's negative feedback. And they're just trying to reconcile, all right, what's the right motor path? What's the right thing that I should be doing? But then they walk across the room and get all this applause and excitement from family and their parents, of course. And so that's like that positive reinforcement. So both positive and negative feedback is going to make your learning more centered and have your brain fixate on this. This is the pathway that we should be focusing on. So let's make sure this is also something important that we can maintain in long-term memory. So that's 1, 2, 3. Number 4, consolidation. Consolidation is like the summary of all these things where everything you just learn, these motor movements, things that you've memorized, whatever, is just automatic. Easiest examples that we have are nobody really is thinking like how to brush their teeth. Nobody really thinks hard how to tie their shoe anymore once they've learned the skill, or how to ride a bike, or how to drive a car. So how many times do you get in your car and you totally blank out, and then you're halfway down the road, you're like, did I just not think once while doing this whole complex process? Think about it. You open the door, you get in, you adjust your seat, you adjust mirrors, you put your seatbelt on, you shift, you look behind you. All those steps are just so second nature. And so that's that consolidation, making things automatic, where your brain knows this pathway. As soon as you need it, it's retrievable. You don't need any working memory to pull that up. There's no wasted like time or space for that. So again, the four pillars are great: attention, engagement, feedback, both positive and negative, and then consolidation. The more you do something, the more automatic it becomes. And don't lose track of sleep. Sleep, especially REM sleep, is the most important they've found through studies for like consolidating long-term memory.
Absolutely. I think, especially as a newer educator coming out of residency, when I discovered the concept of the four pillars of learning, I think it really changed my overview about how I teach. And I try to pass that on to residents just through different examples. But I really think that it sets such a great foundation for us. I think it has so much applicability that is very valuable. The sleep comment is great as well, because if you're running on 3 to 5 hours of sleep, you're not going to be able to have that long-term learning that you really want to have in critical moments. So that's all really valuable stuff, Nate. I think this episode has been fantastic. So let me ask you a follow-up question. Now that we've talked about a lot of these great evidence-based strategies, if I'm a first-time listener and I'm listening to this episode, what are the three key big takeaways that I should take away from this episode?
Absolutely. We're great in emergency medicine to be like, I need to summarize this huge complex piece of information to the most simple forms. We do that with like, everything that we do. So that's our main thing. And I love that. So let's kind of focus on main three. I'd say number one is if you really want good learning, it's got to be effortful. You have to try for it. And so when you do things to study or to relearn or to the first time you're learning something, if it's not coming a little bit more clunky, a little bit more difficult, a little frustrating, then it's not going to stick long term as easy. So if you're passively reading, passively watching videos, passively absorbing information, that feels easy, but it's not effortful. You're going to have to relearn that again later on. So the more effort you put into learning, so that's varying up your practice, interleaving, which is just kind of mixing things up even more, just making things a little bit more clunky is going to go a long way. So that's number one. Number two, I'd say that spaced repetition is king. We've talked about cramming. We've talked about how that's positive in the short term. If we're just focusing on medicine, nothing we learn should be for the short term. It should be all focused on, well, these are important pieces of information that I need to keep long term for my patients for several years, for decades, for whatever it is, because I'm going to be in this field for as long as possible. And my patients depend on me being able to retrieve this information at the drop of a hat. And it's very important information, of course. It's people's lives and health at stake. So the more you space your practice, the more you try to retrieve that. That goes back to point number one. It's making things more effortful. Hey, I need to review NRP every now and then. Like, oh, that's so stressful to like go through this algorithm and put myself in that situation. But that's that spaced repetition that's going to make a huge difference. Those are just some of the examples that spaced repetition is highly valuable for. So that's one. That's two. Number three, whatever you're learning, whether it's medicine, whether it's how to golf, whether it's how to play an instrument, whether it's how to be a better parent, those four pillars apply to everything that you do. And so just to restate those again, the four pillars: attention, engagement, feedback, consolidation/sleep. Everything that you do in life, if you can see it through that lens of like, okay, I need to focus on these four things, you're going to learn it and it's going to be stuck for the long term.
Awesome. Those are really the three key most valuable takeaways for me as well from this episode. Like you're saying, good learning has to be effortful. Spaced repetition is the king of it all. And from our standpoint, that's the only thing that we have to help us combat that forgetful curve that you talked about earlier in the episode. And then those four pillars. If you're a newer educator out there, honestly, I would take the time to read up on these four pillars, because the more you know about this concept, the easier it is to connect with your learners and help them take that next step that they need to be taking clinically. And I think that's very valuable. So, Nate, thank you so much for your time, man. This was a vision that I had for a long time. So I'm so happy to have you on. And when you had talked to me about this episode about evidence-based learning, it just clicked. It made sense. So I couldn't be more happy to have you on.
Absolutely. I'm happy to be here. Thanks for having me.
It's been a great episode. Do you have any social media that folks can reach out to you to connect with if they have any further questions?
Yeah, absolutely. So I'm social media director of our residency program. And so that's probably the easiest place to find me. So that's CHGR underscore EM underscore RES, CHGREM res. So that's here, Grand Rapids, Michigan, and happy to connect with you all. Let's keep this conversation rolling. I love talking about this.
Awesome. And what I'll do is I'll link that in the show notes. So for anybody that's looking to connect with Nate about any of these great ideas, he is your guy and he's very approachable. And I think that can help to just elevate your learners at your residency program or your medical students to the next level. So this has been a fantastic episode. As we're getting ready to wrap up, I want to pose a question to our listeners. What kind of evidence-based strategies have you guys used to help engage your learners? Let's keep the conversation going, because that'll help us become better educators. There's a lot of wonderful and fantastic ideas out there. And the only way we can get those ideas out there is if we continue to have that conversation. So thank you again for this incredible episode. Looking forward to working with you guys and chatting with you guys again. Follow us on Instagram, and the Instagram is at thelearningcurve.podcast. We're also on Spotify and Apple. So looking forward to keeping the conversation going. It's been a fantastic episode. See you guys